this is Jack. My patient today is Jack. Jack is just recovering from peroneal nerve palsy, um, which has been impacting his right lower extremities. Okay, he has stated that he has some limitation in active dorsiflexion and muscle performance. Recently, we've done manual muscle testing, and he scored 2 plus out of 5. And he also have stated that his goal is to gain, to enhance that motor functioning, and we believe that that can be done through muscle reeducation, given that muscle palsy that he had. Okay, so as an appropriate agent that we've been considering for to help Jack is the MNES. So even before we can use this agent, I wanted to run through some contraindications. I have reviewed the chart and checked some contraindications for the usage of this agent. One being the presence of blood clots or clotting in the lower extremities, so that he doesn't have any pacemakers or cardiac implants. Since we're not applying the electrical stimulation into the carotid sinus, that should be okay. Also, he doesn't have any allergic reactions to adhesive or any kind of like dermatitis in that area or open wounds. So at this point, I'm gonna go ahead and introduce myself to the patient. Hi Jack, my name is Maria. I'm a student of physical therapy, and I'm here to provide a physical agent for your goal of enhance the muscle functioning to the right lower extremity, so to see if we can have any improvement to your dorsiflexion. Okay, so would it be okay if I work on you today?
Yes.
Okay, great. Do you have any questions at this point?
No.
Okay, so I know I mentioned MNES, and you probably don't know what that is. Well, MNES is an electrical stimulation, right? So I wanted to be sure that that's okay, that you don't have any apprehension for me using kind of an electrical stimulation in that area. Okay, good. So I'm gonna be using 2 different electrodes or patches, okay? One about this area and another one around here, okay? And then I'm gonna put the settings, and then you're gonna feel a contraction, okay? It's visible though, you will see it, okay? And but it should be comfortable, okay? If at any time it feels uncomfortable, please let me know, and we can adjust the settings, okay? Also, once we position you, I will indicate what you need to do because the contraction is not permanent, it goes into pulses, so I will also indicate you when to contract, okay? Because I want you, when the machine comes on, you need to contract the kind of do like the dorsiflexion, okay? Well, dorsiflexion is actually bringing your toe towards your shin, okay? In case you don't know what that is. Okay, so as far as like the pre-testing, how we will address the pre-testing, I have already observed her gait to see how she walks, okay? And also, I will do a passive and active range of motion for dorsiflexion, okay? So now that we have addressed that, we are going to go ahead, if you don't mind, laying on your back, okay? We're just gonna use one pillow, if that's okay, here. Maybe you wanna scoot over, are you comfortable there? Okay. So, since her injury is on the right side, so we're gonna place, okay, let's see here. We're gonna place 2 pillows under, here. Maybe more like that. Is that comfortable? Actually, let me see. Let's see. So, there we go. How does it feel?
It feels good.
Okay. Actually, okay, here we go. That looks better, right? It's better, okay. So, at this point, you okay? Have any questions at this point?
Not yet.
Okay, good. So, we're gonna go ahead. We check the area, make sure there is no redness. So one of the electrodes is gonna go, since we're targeting the anterior tibialis muscle, which is the main, one of the main muscles for dorsiflexion, we're gonna place one electrode right there. And the other one by the ankle, okay?
Had one in there and then I downloaded one and made a YouTube link.
All
And
right.
then put the link in there and it let me upload.
We connect the electrodes, of course.
So I had the one video that I already did in Bongo. And the other one, I just downloaded it to my computer and uploaded it to
Okay.
YouTube.
So as part of the settings right here, we are going to use, since we're trying to accomplish muscle relocation there, we are going to set the ramp at 3, which is already set at 3 right there, okay? The contract, and we're gonna try to keep a ratio of 1 to 3, but, okay, with a frequency of 30. Okay, so but because we want to make sure that when the current comes in, it doesn't make her very uncomfortable, we are going to first turn the on time and then the off time. Okay, so the on time we want to set it at 10. Okay.
Really? Well, I kind of expected the Bongos. And I
Okay.
also studied that whole PowerPoint tomorrow, so.
And slowly we are going to start bringing the intensity up. And again, it should feel like a tingling sensation, and if at any time it feels uncomfortable, please let me know, okay?
Okay.
And once you
So what I
feel
did
okay, let
is
me
I
know,
went back
because
to
that will be the
work.
indication when to set up the off time, okay?
Down there. So go ahead
Here
and
we
save
go.
your other video and get it going to either like YouTube or however you do it to
I
make
feel it.
You feel it? Okay. So since the patient can feel it now, Fred can feel it right now, so we're gonna go ahead and set the off time right at 30. Right at 30. Okay.
Yeah, whatever I had uploaded it to YouTube.
All right.
And just like
So
get it, you have to make it
normally,
so they can keep it. And then I'm just gonna
um,
start it later. But
normally
put it
in
there,
a
put it
regular
later.
situation, we would do this treatment for 10 minutes and try to get 10 repetitions, okay? But given the purposes of this assignment, we're gonna go ahead and end the treatment right now, okay? Of course, first, we turn off the machine,
And then hit reset submission and this should stay in there.
okay? Remove
Yeah,
the
and then,
patches,
add.
assess the area, make sure there is no redness,
Title it and then put the link.
any kind of skin irritation.
Yeah, he had.
And after we do that, of course, we're gonna proceed with the same type of post-test that as we pre-test. So we pre-test with a gait, and we pre-tested with active and passive dorsiflexion. So we will use those same techniques for the post-test, okay? And so then we can compare and see if the therapy was effective at all, okay? And then again, we observe the area, make sure there is no redness, and we also instruct the patient to keep an eye on the area in case any redness develops when she goes home. And if it does, to please inform me, so then we can address that maybe with a different settings or a different type of treatment. Okay? Thank you.